we have to do is spend the money on research.
We should. Absolutely.
It's real simple.
I agree with you, Senator, 100%.
And some universities aren't. NIH is not calling them on it.
Welcome to Congress Unpacked, where I break down the moments, the clashes, and the truths the headlines leave behind. Today, Senator John Kennedy took the gloves off with the National Institutes of Health Director Dr. Jay Bhattacharya. It started with a jab. "Doctor, you don't look like Satan to me, I hope not." Kennedy wasn't pulling punches. He wanted to know, does NIH leadership really care about medical research, or is something else going on? Kennedy zeroed in on funding. He raised a blunt question. What if universities are using NIH money for luxury perks, not for finding cures? He pointed out that elite universities like Harvard and Yale are using over 2/3 of their NIH grants on overhead costs, not on actual research. That's a serious claim.
Doctor, you don't look like Satan to me.
I hope not.
Some of my colleagues have accused you of everything but abandoning your children to wolves. Do you hate medical research?
I've devoted my life to medical research, Senator.
Do you hate the NIH?
I love the NIH. I think I said that in my Senate hearing, my earlier Senate hearing. I think it's the most important biomedical institution in the world.
This budget that we're debating today is the president's budget. When's the last time Congress took a president's budget and enacted it?
You know, the funny thing is, I've gotten thanks to this process, I've got to talk with all of y'all.
When's the last time that happened?
I can't remember.
It's never happened in the history of ever happened.
I mean, everyone has strong opinions about what should happen, and Congress gets to have a say, and that's a good thing.
There's some changes that need to be made at the NIH, aren't there?
There are.
Okay. If I'm the president of a university, and I came to you at NIH and said, I need $10 million to research a cure for nephritis. And I took that $10 million and spent $5 million of it renovating the vice provost home. That would be morally repugnant, wouldn't it?
It would.
If I were a college president and I came to NIH and asked for $20 million to research a cure for dementia, and I took $5 million of that and used it to buy a yacht for my university, that would be morally repugnant, wouldn't it?
That would, and no, that's not.
And that's happened before, hasn't it?
That's not hypothetical, alas.
And there's been a lot of talk about the difference between direct costs, spending the money, for example, on researching cures for nephritis, and indirect costs, overhead. Harvard, for example, with a $53 billion endowment, spends 69% of its money from NIH on overhead, does it not?
I haven't looked at the latest numbers, but it's definitely in that range.
Yale spends 67.5% on overhead, does it not?
Again, roughly in that range, yes.
So all this money spent on overhead is money that's not being spent on medical research, is that right?
Well, it's for fixed costs of like lab space and things, but also sometimes for other things. So it's some of it's absolutely necessary.
Well, if I'm the Gates Foundation, and I came to the NIH and said, I don't want money. I want to give you money. I want to give you $100 billion.
Yeah.
But you can't spend more than 10% on overhead. Would NIH turn it down?
I wouldn't turn it down, no. In fact, I think that Gates Foundation overhead rates are roughly, again, in that range, 10 to 15%.
The Robert Wood Johnson Foundation limits overhead to 15%, does it not?
That's what I understand, something like that.
Now, I want you to think in terms of the American people and the importance of medical research. What do you think is more important? And we have finite resources. Okay, and I support giving resources to NIH. I think NIH does breathtakingly innovative work.
But he didn't stop there. Kennedy went after spending priorities. Would Americans rather see their money going to cures for devastating diseases, or to $142,000 studies on telehealth and gender-affirming care, or $120,000 for 3D avatars to help with gender dysphoria, or millions for projects on LGBTQ mental health during COVID? Kennedy's message was sharp. Taxpayer dollars are meant for real medical breakthroughs, not social experiments, and not padding university budgets.
But if you ask American people, would you rather give money to research cerebrovascular disease, or would you rather give $142,000 to the Seattle Children's Hospital to study how to use telehealth to improve access to gender-affirming care? What do you think the American people would say?
Senator, the NIH should be a non-political organization, non-ideological, addressing the health needs of the American people.
But yet, the NIH also spent $120,000 in a grant to, quote, develop 3D avatars that help people work through gender dysphoria, end quote. Did it not?
It did.
And the NIH also spent $2,368,492, gave it to Brown University to study, quote, improving mental health among the LGBTQ community impacted by the COVID-19 pandemic. Did it not?
I think it did. Although I have to say that
Do you think that's more important than studying chronic lower respiratory disease?
I mean, I think we should address the real health needs of Americans, not divide Americans into we have to take into account the real differences in in the biology of people. But when we do that, we should do it in a way that really addresses their actual health needs. Not
I'm running out of time. What we have to do is spend the money on research.
We should, absolutely.
It's real simple.
I agree with you, Senator, 100%.
And some universities aren't. NIH is not calling them on it.
Then came the knockout punch transparency. Kennedy called out NIH for letting clinical trials go unreported. Isn't it a fact that between 2017 and 2019, 137 taxpayer-funded trials involving 41,000 kids never even reported their results? That's millions in public money with nothing to show for it. The NIH director admitted, researchers have a duty to make data public, win or lose.
Isn't it a fact that a study showed between 2017 and 2019, auditors found 137 critical trials funded with taxpayer money involving 41,000 kids, and they didn't even report the results? What happened to the money?
Senator, I think that researchers we support have an obligation to share their data publicly with the American people, no matter what the result.
Otherwise, it's wasted.
Yeah, agree.
All you want to do is fix NIH, don't you?
I do. I want to fix all those problems, Senator.
Thank you, Madam Chair.
So, what's really at stake here? This wasn't just a budget hearing, it was about trust. Kennedy's bottom line was clear. If Americans are paying, why isn't more money flowing directly to the science that saves lives, and why aren't universities held to account? That's the bigger battle in Washington. Is NIH sticking to its mission, or getting lost in politics and profit? You've been watching Congress Unpacked. If you want more breakdowns like this, hit subscribe and like so you never miss what really matters.